I'm going to talk about a recent oral history book project that I undertook at the University of Strathclyde, exploring children's services workers' experiences of residential care in Scotland from 1960 to 1975. I'm going to start by setting the scene, providing the background and context for the research, before going on to explore the methodology of the study and the issues that it presented, before finally going on to touch upon the findings of the research and the implications of those findings for future practice. So the historic abuse of children in residential care in Scotland has been thrown into recent high profile. Following an apology by Jack McConnell, the former First Minister of Scotland, in 2004, the Scottish Government has responded to this issue in a number of ways. This has included setting up a support service for victims of abuse, work on access to personal records, and following a pilot forum, a national confidential forum for adults who experienced care as children, in order to, and those who have suffered abuse, in order to give them a chance to recount, to retell their experiences. In addition, the narratives of former Scottish children's home residents are also in evidence in works such as that of Professor David Devine, whose study explored the experiences of those at Arbalaw Orphanage in Scotland. Most recently, and after a lengthy process of consultation, in December 2014, the Scottish Government announced its intention to hold a national inquiry into historic child abuse, and this started its work on the 1st of October 2015, chaired by Ms Susan O'Brien QC. Now, responses to the issue of historic abuse in Scotland to date have understandably tended to focus primarily upon the experiences of former residents of institutional care. And their narratives have and will, via the public inquiry and National Confidential Forum, provide valuable accounts of residential life, both negative and positive. However, another important perspective which has received relatively little attention is that of the people who worked in or in connection with children's residential care services. So, for example, care home workers, managers, social workers and social work managers. And this is despite the fact that research has revealed how children's experiences in residential care are in no small part influenced by the actions, the perceptions and the actions of those professionals who work directly with them. So it's therefore vital to take their perspectives into account when considering the nature of former practice, so when considering why children were cared for and responded to in particular ways, and how therefore abuse can be prevented in the future and positive outcomes achieved. And it was with this in mind that the University of Strathclyde embarked upon a study of children's services workers' experiences of residential care in Scotland from 1960 to 75, with the aim of exploring three overarching themes. So it was with the aim of exploring the workers' lived experiences and perspectives of working with children in residential care, the standards of care and their perceptions of the experiences of the children, and their views on change and developments in residential care, both during the period under review and subsequently to the present day. The time period chosen allowed exploration of provision both before and after the implementation of the influential Social Work Scotland Act 1968, a key piece of legislation for child welfare. I'll now move on to talk about the methods used in the research project, and to begin with, a review was undertaken of the relevant literature, research and policy documents in order to add to the historical context of the workers' experiences, including what previous research reveals about residential care in Scotland at the time. Although an in-depth exploration of what was discovered during this review is beyond the scope of this presentation, it revealed that while generally residential care was considered to have improved during that period, there's little research which details the actual experiences of those who were present at the time. So it was therefore felt that the oral history study would make a contribution towards filling those gaps in the knowledge. Oral history is based on recording and preserving the oral testimony of participants and the product of that process. It encompasses various forms of in-depth life history, interviews, biographical interviews and personal narratives. And Thompson asserts that the study of oral history can give back to people who made and experienced events through their own words a central place. And this was considered to be particularly important as a means of giving a voice to workers who had not so far been given the chance to communicate their stories and perspectives regarding the way that children were treated and responded to at the time. Now, following on from the apology given by the Scottish First Minister in 2004 and subsequent calls for a public inquiry into historic abuse, the popular discourse had been upon residential care as very much a negative experience. Accounts of survivors of the care system had revealed instances of staff cruelty, abuse and neglect, which culminated for some survivors in lifelong suffering and disadvantage. So it was felt that by providing a means by which workers might give their accounts of residential care at the time could potentially shed further light on these experiences, which in turn might have value in ensuring that future practice doesn't repeat the mistakes of the past. However, at the same time, we were keen to emphasise that we were not simply looking to focus on negative experiences, and I think that it was this emphasis that made the idea of participating more attractive to many participants. Participants were actually invited to provide their individual accounts of residential care at the time, and for a number that was a largely positive experience, both for themselves and as they perceived it for the children too. We were aware that a number of factors could mean that it could be potentially difficult to recruit participants to the study. So firstly, of course, there was the length of time since the events in question, which meant that people might long since have retired or even passed away. In addition, given the potentially sensitive nature of the research and the negative publicity which has surrounded the campaign for an inquiry into historic abuse in residential care, it was a real possibility that people might not wish to participate for that reason. And an example of this occurred when I contacted representatives of a large, well-known childcare provider in Scotland, whose practices have been the subject of a degree of negative scrutiny. They were very wary of the study and of potentially bringing further negative publicity upon themselves, and consequently declined to supply contact details of potential participants. Other large organisations also just failed to respond to requests for help. So it was for this reason that participants were primarily recruited by purposive and snowball sampling strategies from existing networks, which, while not guaranteeing a representative sample, nevertheless enabled the study to focus on people who had the necessary knowledge and expertise. So people within the team at the University of Strathclyde and contacts they had made knew people who worked in residential care during the time period, who in turn knew others. At every interview I undertook, I asked the participant if she or he could recommend others who might be willing to participate. I also attended a number of events which brought together survivors of abuse in residential care and those who had previously or currently worked in the sector. And at those events I distributed leaflets calling for participants or talked directly to potential participants. I also set up a WordPress blog which was posted on relevant social care websites. As previously stated, we were careful not to frame the study in negative terms. The information leaflet stated that by speaking with the researcher and allowing the researcher me to record their memories, the participant would help to construct a valuable understanding of what it was like to work in residential childcare in the period under review. So the emphasis of the study was not upon finding and analysing negative experiences and practices, but rather exploring the wide range of potentially positive and negative experiences and learning what we could from that. And I think that encouraged people to see their participation as something positive and valuable. Now, in the event, 23 people agreed to take part, and they all had their own reasons for doing so. One participant stated that she wanted to take part in the study as a means of what she termed setting the record straight. She had previously worked in a children's home where it was later found that abuse had taken place, and she was very angry that she hadn't been called upon to give evidence at the subsequent inquiry. She therefore wanted to give her account of events. Another participant, who described both positive and negative experiences, said that now that he was nearing retirement, he wanted to put on record what had happened all those years ago. And on a more personal level, he also said that he wanted to have a record of events so that his children and grandchildren might have a greater understanding of what he used to do. Another participant, who had had overwhelmingly bad experiences while working in a List D school for girls, which was where children were sent by the criminal justice system, conveyed a real sense of disgust that even after the passage of over 40 years was still very potent. And she very much felt that she wanted to bring those experiences out into the open. Conversely, those who had experienced residential care in much more positive terms were likewise keen to emphasise this. They wanted it to be known that they had tried their best and that they had the best of intentions, even if it wasn't always remembered that way by the children. I undertook in-depth, recorded, semi-structured interviews with the 23 individuals who had experience of working in or in connection with residential childcare services in various parts of Scotland during all or part of the period from 1960 to 75. These were one-off interviews which varied in length from approximately 40 minutes to 2 hours. Participants ranged in age from their mid-50s to their mid-80s and had been at different stages in their respective careers during the period under review. Some were very young and inexperienced at the time, being barely out of school or university, while others had more knowledge and seniority. Female interviewees outnumbered males. There were 18 females and 5 males, possibly in part reflecting the gendered nature of much childcare-related work, particularly at the time. In terms of the interviews themselves, these took place in a variety of locations. Some of the participants preferred that they take place in their own homes, particularly the more elderly participants. So, for example, I travelled several hours to interview a woman in a remote area of Scotland, whereas others indicated a preference to come through to the university offices. Through the participants' information sheet and often a direct conversation or email correspondence before the interview, participants were aware of what would happen and the nature of the interviews, including the areas that we were looking to cover in the oral history narratives. And I also had an informal chat with all participants prior to beginning the recording to answer any final questions and put them at their ease and so forth. The actual participants themselves included residential childcare workers and managers from a variety of settings. So some came from larger children's homes, some came from family group homes, some came from approved schools or List D schools, residential nurseries, a school for what were termed maladjusted children, and Quarriers Village, which was a large self-contained community consisting of a number of cottages that were headed by house parents and housed around a dozen children each, which was located at the Bridge of Weir in Scotland. Participants included children's officers, so they were the precursor to social workers in Scotland, childcare officers, social workers, directors and deputy directors of social work. 17 of the participants had direct experience of working in residential establishments, and some participants had held multiple positions. For example, they might have started out as a residential care worker later became a home manager. They might have then gone on to qualify as a social worker. Some had worked in or in connection with more than one type of establishment. So in this way it was possible to establish a rich and multi-layered account of workers' perspectives of residential care during the period, which was set in the context of official policy discourses and documentary accounts. Many of the interviewees provided a more micro insight into the everyday workings of the residential establishments in which they had worked, whereas others provided a more overarching macro view of policy and practice at the time, so the directors, deputy directors of social work. Latitude was given for deviation from predetermined themes, and questions were open, so that allowed the participants more freedom and control to articulate their own experiences. And although there were certain areas that as a researcher I wanted to cover, I considered that a successful oral history interview would involve me talking as little as possible, with the emphasis being upon the narrative of the participant. And I found that many were very happy to talk at length about their experiences, often with a minimum of prompting. And in fact, to an extent, I felt that my kind of outsider status, so as an Englishwoman who was of a different generation to those being interviewed and with no prior experience of the Scottish system, was something of an advantage, as it seemed to prompt more in-depth explanations from certain participants. And in line with ethical considerations, it was of course also made clear to participants that they could decline to answer questions they weren't comfortable with and withdraw from the study at any time. They were also told that disclosure of information which indicated that someone had been harmed or a crime committed would be reported onto the relevant authorities. Anonymity has been assured for the participants by referring to them in written outputs and presentations by a pseudonym, and by assigning pseudonyms to any establishments referred to, although in actual fact only a minority of participants actually wish to remain anonymous. Now, McNeill makes the point that within the discipline of history, debates about the relative merits of different kinds of sources have been very well rehearsed in recent decades. And of course, as with any source material, we were well aware of the necessity of exercising critical judgment when assessing the collected data. On the one hand, Thompson highlights how in the final stage in the development of memory, which commonly follows retirement or some other traumatic process, recognised by psychologists as life review, there is an increased willingness to remember, and commonly too a diminished concern with fitting the story to the social norms of the audience. Therefore, bias from both repression and distortion becomes a less inhibiting difficulty, both for teller and historian. In the context of oral history narratives, particularly with regard to the older participants, this could definitely be seen as an advantage for the study. Nevertheless, when you consider that the memories being spoken of are at the very least over 40 years old, there are obvious questions concerning just how reliable are the accounts. Just because someone says something is true, however convincingly they say it, doesn't mean that it is true. Just because someone was there doesn't mean that they fully understand what happened. Thompson highlights that with interviews that go back over a significant period of time, there is the added possibility of distortions influenced by subsequent changes in values and norms, which may perhaps quite subconsciously alter perceptions. In addition, there might be many reasons why someone might want to purposely obscure or be less than truthful about the events that took place. And in the context of this research, obvious reasons for this include that some wrongdoing occurred of which the person was aware, and either wants to protect themselves or others from the potential repercussions of this. As I stated before, the research took place against the background of a campaign for a public inquiry into historic abuse, and we were aware that fear might exist among some potential participants that the behaviour of staff at the time might be seen through contemporary eyes in less than glowing terms. Others might feel a sense of loyalty towards former colleagues, which some were still in contact with. One participant told me about a questionable practice which she later insisted that, while true, should be deleted from the recording and transcript, as she didn't want to be seen as disparaging the unit where she had worked and of which she had very fond memories, and she still kept in touch with a number of former colleagues. Another possibility is, of course, that after such a lengthy period of time, memories might be simply inaccurate. Again, one participant admitted that she couldn't remember exactly where within the period under review and when the event she was describing took place, as she had worked in so many establishments. And of course, sometimes people might interpret the same situation or set of events very differently, based on any number of factors, including their personal beliefs or position within the organisation. So, for example, as I'll go on to describe further, some of the participants viewed the regimentation of childcare at the time in very negative terms, whereas others saw it, while acknowledging its limitations, saw it as a necessary measure because of the large numbers of children and low numbers of staff. Therefore, in terms of maximising the credibility and dependability of the data, we considered that it was important to consider the participants' reliability as a source, and as previously stated, most participants were recruited from established networks, and the internal consistency of their accounts. The veracity of what was said in the interviews was also gauged by comparing it both with other interviews on the same subject. So, for example, an abusive response to bedwetting, which was identified by some participants, had also been identified from the narratives of survivors of abuse in care. And at various points in their careers, and not necessarily at the same time, 4 of the participants had worked at the same establishments and gave very positive accounts of its working practices. The data was also compared with related documentary evidence relating to the wider context of policy and practice at the time. For example, the literature review revealed that in the 1960s and 70s there were major issues of staffing in residential care. It was found that shortage of staff was a chronic problem in a number of establishments. A number of commentators at the time also highlighted the rapid turnover of staff, which was linked to factors such as poor pay and conditions, and the difficult nature of the task. And this in turn links back to the point I've just highlighted that was made by many participants, indicating that there were low numbers of staff to look after large numbers of children, with many also highlighting poor pay and a lack of preparation and knowledge with which to undertake their roles. Nevertheless, it is acknowledged that the reliability of any data stemming from the distant memories of participants talking about a potentially controversial subject matter can't be guaranteed, and the resulting data is presented after acknowledging those caveats. I undertook the transcription and thematic analysis of the qualitative data, which involved immersion in the data, considering recurring themes across the interviews and across the narratives as a whole, and I'll now go on to touch upon the findings of the study. Now, a striking feature of the accounts of a number of the participants was their lack of experience and training to prepare them for the challenges of working in a residential establishment. So, as you can see from the first quote, James says there was very little supervision of any kind, very little training really, very little support in terms of understanding the child's behaviour or psychology. You just kind of had to feel your way. And certainly, especially earlier on in the period under review, people were employed because they were either raising or had raised a family of their own and had demonstrated an ability to manage a household, or simply expressed an enthusiasm for working with children even if they had no prior childcare experience. Some were on student placements, training to be nursery nurses, or intended to pursue a social work career and needed to gain experience in order to be considered for entry onto an approved course. A number were very young, just out of school or university, as I said previously, and some had left home for the first time in order to take up a living position at a children's home, and consequently found the work quite daunting and at times shocking. So you can see from the second quote, Jenny says that their language, their way of operating as children was so alien to my experience Looking back, it was just awful because I was so naive. Indeed, some expressed how they wished that they had more knowledge of child development and psychology, including the impact of prior experiences, which they felt would have enabled them to undertake better work with the children, and at times to recognise the telltale signs of abuse. As you can see from the third quote, one participant, as I mentioned earlier, recalled working in a place where it was later discovered that abuse had been perpetrated by a staff member, and she was very upset that she hadn't recognised the signs of this. She says, in hindsight the signs were there, but first you need to know what the signs are before you can know that something is not right. A link to this, a large number of workers who were lower down the hierarchy of the homes reported that they were actually provided with little or no information about the backgrounds of the children they were looking after. A former childcare officer, which was precursor to social worker, confirmed that she and her colleagues didn't tell residential staff much about the children they were looking after, and felt that in hindsight they were at fault for this. However, she explained that this was simply how things were done at the time. As a consequence, staff had little or no knowledge of any experiences which might have impacted upon the children's subsequent behaviour, which, combined with a lack of awareness of issues around child development, trauma and abuse, could mean that the children were responded to less than sympathetically when they presented difficult behaviour. And an example of this could be found in responses to bedwetting, which was reacted to in some establishments as if it was willful bad behaviour, which was within a child's power to control. So as you can see from the final quote, she used to rub his face in the wet sheets and be really nasty verbally towards him. Many participants described working in or in connection with places where institutional imperatives largely predominated. So Thomas says children were expected to conform, and they did conform by and large. And homes were fairly regimented, which was often linked to individual leadership styles which invariably set the tone for the establishment. Now, although this was viewed as inappropriate and oppressive by many, others felt that it was in part necessary due to the large numbers of children of varying ages and needs that were accommodated and the relatively low numbers of staff. It was reported that children were often not treated as individuals, with some describing how they didn't have their own clothes or space to store personal possessions. In the main, participants recalled not having sufficient time to provide one-to-one attention for the children. And this was a matter of regret for many, who reported that whilst the physical needs of the children were mostly attended to, they were fed, they were clean, their emotional needs often were not. And certainly the homogeneous, institutionalised nature of some residential care provision continues to be linked to poor outcomes in current times, demonstrating that there are still lessons to be learned in this respect. The predominance of institutional imperatives in some establishments meant that conditions were created whereby potentially abuse might occur and remain unchecked. Methods of restraint were at times used to control the children, and although some interviewees expressed that this was at times necessary and not undertaken either lightly or routinely, it certainly caused consternation for others. So Harriet says, "It was the way of childcare then that if a young person was upset, you sat on them. I thought it was cruel and unnecessary, and I still think that it was cruel and unnecessary." While different methods and techniques might now be used, the physical restraint of children and young people in residential care continues to be a highly contentious issue, with recent research demonstrating a continued ambivalence towards its use from both young people and staff. Nevertheless, as has been found to be the case in more recent abuse inquiries, it became apparent that many felt unable to raise concerns, as staff were expected to toe the line and not question existing orthodoxy. In fact, in some places, the questioning of practice was at times met with derision and occasionally outright hostility by other staff members and those in charge. So, as you can see, Violet, a childcare student on placement, says, I tried to say to the manager that I was concerned, and she just shot me down in flames and asked me if I wanted to get through this course. I was persona non grata from then on. As a consequence, many, especially inexperienced younger staff, felt unable to express their disquiet, with some eventually choosing to leave. In addition, it was reported that particularly prior to the implementation of the 1968 Social Work Scotland Act, this lack of accountability was further perpetuated by a virtual absence of external oversight and inspection, with infrequent visitors by childcare officers, social workers, and the unwelcoming nature of some establishments. So Rebecca says, looking back, I think that many of the kids were dumped by social services. And Elizabeth says, some of the more austere regimes were quite happy to keep you at a distance. You were a nuisance. I do remember that it was quite hard to see children on their own, and if things had been going on, I don't think I would have known, because there was always the kind of brooding presence of a senior member of staff. This approach was exacerbated by the reluctance of social services to challenge existing practices due to the belief that the homes were undertaking a difficult role. Arguably, the perception of young people in care as being a challenging group in need of containment and control has impacted upon their treatment since the 1834 Poor Law and continues to do so to the present day. As is the case in current times, when children are at times placed out of area by their local authority, these issues were at times both perpetuated and compounded by the remote locations of many of the establishments, and the fact that children were often placed at a distance from their families, who as a consequence of the poverty that predominated at the time frequently didn't have the financial means to visit. Even so, respondents reported that efforts were made to improve things for the better, and that as time passed, especially after the Kilbrandon report in 1964 and the passage of the Social Work Scotland Act in 1968, the more authoritarian staff were gradually phased out and replaced with staff that were recruited and trained in a more child-centred way. However, it took time, sometimes years, for some of the Act's provisions to be enforced. And attitudes on occasion proved harder to change, as recalled by a former director of social work when he described how a newly trained residential worker, had asked another member of staff to smack a child who was misbehaving because she felt that she couldn't do it herself, as it had been discouraged on the training course that she just attended. Nevertheless, while there have long been concerns about abuse of children in care and evidence of poor outcomes and poor practice, there's also ample evidence of the positive role that residential childcare can play. Several national inquiries have concluded that residential care is a positive choice for some children and young people, and certainly a number of participants in the current study felt that both their experiences as workers and those of the children were extremely encouraging. So Elizabeth says, I do look back and see some outstanding officers in charge who really were ahead of their time. And Catherine says, in the unit that I was in, there was a lot of physical affection. It was very clear that my job was just to love children. I was taught to treat the children with such care and love and respect. The second quote describes the experiences of a former worker in a school for what were termed maladjusted children, which was operated by a religious order in the 1960s and 70s. She expressed that it was ahead of its time in terms of the way it worked with and responded to the children, some of whom were deemed to be extremely challenging for a variety of reasons, including residual trauma precipitated by prior experiences, or possibly being somewhere on the autistic spectrum, although this diagnosis wasn't recognised at the time. Here the children all had their own clothes, staff knew about their backgrounds, and the school was run in accordance with a therapeutic model of intervention. Similarly, a participant who had worked in a relatively small family group home in the 70s described the experience in very positive terms. She said that the children were well looked after and she felt supported and encouraged as a staff member. In fact, many of the participants described good times, including the children being taken away on holidays and outings, and how, especially in smaller family group home settings, They were encouraged to interact with other children from the local community, to bring friends home for tea, and to join local clubs and societies. It was also emphasised how workers at the time had the freedom to undertake activities with the children which might not be possible today due to concerns for health and safety. These included residential workers taking individual children on holiday with their families. It included taking large numbers of children on outings with few staff members and canoeing trips with workers who had not undertaken any form of water sports qualification or training. It was expressed that these practices were routinely accepted with little or no thought given to potential risk. Freedoms of the pre-risk averse era also included being able to demonstrate physical affection, which many felt that they would now be prohibited from doing as a result of the high-profile abuse scandals. So Catherine says, there were lots of hugs. Sister Violet would be hugging a child or she'd be holding a child. So I think that when it went well in the past, it went really well. Some of the concerns have been about where I think some people have abused that and it's caused real nervousness. And Louise says, demonstrative care is something that I think we need to find a way back into, to allow folk to feel that actually children do need affection that can be safely offered, and that they should be supported to do that in a way that's not obsessed with risk. Indeed, although participants felt that in many ways residential care practice has improved, concern was also expressed by some that the better aspects of past provision are being lost and that we're in danger of creating what's termed an emotionally sterile environment. Certainly Kendrick highlights how there has been an increasing tension between defensive practice and professional distance, and the need for positive relationships between children and residential staff members. Given that researchers emphasise the value that young people place on family-like relationships in residential care, along with the necessity of good staff-resident relationships in promoting favourable outcomes, this is an issue which requires further consideration in the future. So, to conclude, while contemporary responses to the issue of historic abuse in the Scottish context have tended to focus upon the experiences of former residents of institutional care, it's clear that much can also be learned from the narratives of former childcare workers. Indeed, while acknowledging the caveats inherent in such research, such accounts can provide valuable insights into why children were cared for and responded to in particular ways, how abuse can be prevented in the future and positive outcomes achieved. It's apparent that despite the intentions of various legislative and policy initiatives and a generally positive portrayal in the available literature of the residential care sector during the period under review, that the ideal of child-centred practice was very far from being achieved in many establishments, with conditions being created in which abuse could potentially occur and remain unchecked. Now, the reasons for this were numerous and included a lack of experience and awareness of issues relating to child development, abuse and neglect, the predominance of institutional imperatives and an inability to raise concerns, combined with a lack of external inspection and accountability. And in fact, while improvements have been made to the sector, they were made to the sector both during the period under review and subsequently, a number of issues alluded to still have a contemporary resonance, and as such, the study concluded that we should guard against complacence and be aware that without further changes and continued vigilance, children will continue to be at risk of abuse in its various forms. However, accounts were far from wholly negative, and it's clear that children experienced a wide variety of provision during the period under review, some of which was progressive and endeavoured to be caring and fun, and it was consequently considered that we should be wary of allowing a focus upon risk-averse practice to obscure the merits of some of the more protective and nurturing elements of former residential childcare work, particularly in terms of the relationships between staff and children, which, if undertaken correctly, can provide the most positive experiences of care. Thank you.